Today topic is Ryle's tube. We can also call it as nasogastric tube. So the tube will be inserted through the nasal cavity and it will enter to the nasopharynx. From there, through esophagus, this will enter to the stomach. Different sizes. So these are all pediatric sizes and this will be used for the adults. Okay, so this you can see from starting from 8, 10, 12, 14, 16 and 18. Okay, so we you can see the color also. See, the 10 gauge looks black color, 12 looks white color and 14 looks green color and 16 looks orange and 18 looks red or maroon color. Okay, so these are all the sizes of Ryle's tube or nasogastric tube. Okay, so this nasogastric tube made up with a silicon tubings, narrow tubings will be inserted to the patient's stomach to give a nutrition to the patient, or when patient had any like a OP poison, to aspirate the content from the stomach, this will be used. So the purpose of inserting of a nasogastric tube is to feed the patient with fluid or oral intake. When patient is not able to take a oral fluids, so we can introduce the fluids through the Ryle's tube. Okay, and also dilute or remove stomach content if patient has taken any OP poisoning. No, so in that case, so we'll introduce a saline into the stomach and will aspirate the content. So in that way also this tube will help for the patient. And install the ice cold solution if the patient is having any gastric bleeding. No, so in that case, through introducing of a cold water or ice water into the patient's stomach, we'll use a Ryle's tube. Okay, and to prevent stress, or if a patient operated site decompressing of a operated site, will use a this Ryle's tube. And sometimes we'll use to prevent vomiting and distension of a abdomen. We'll use a Ryle's tube to prevent distension of a abdomen. And also we'll use this Ryle's tube to collect the gastric content for investigations. So these are all the purpose for inserting of a Ryle's tube. So this Ryle's tube made up with the silicon tube, and here you can see the parts of Ryle's tube. Okay, so this is the tip. So Ryle's tube tip. So you can see this tip, it is very blunt. Okay, so when we are inserting into the patient nose, so the nostril should not get any damage. So in that case the tip should be blunt. So that's why they made up with a blunt. Okay, so this is the tip and this is the body of the Ryle's tube. This is a body of Ryle's tube and this is a base of a Ryle's tube. So there are three part of Ryle's tube. One is tip and body and base of the Ryle's tube. Okay, so and here you can see one line. When we do any x-rays, no, we can find out the position of the Ryle's tube. See, this is the radio opaque line, so that will come to know when we do the x-ray the Ryle's tube position also we can identify with this line. Okay, so these are all the holes. You can see there are 4 holes. Okay, with that we can introduce the fluids, or for aspirating of a fluid from the stomach, this will help. If one hole get blocked, from the another hole we can get a help to get a aspiration or introducing of a fluid inside to the body. Okay, so this is the part of Ryle's tube. And so you already came to know what is the purpose of Ryle's tube insertion. And to insert a Ryle's tube we should have certain material with us. So these are all the Ryle's tube. Before inserting a Ryle's tube we should keep ready these are all the items. Like, see, already I told you, before inserting of a Ryle's tube you should use a local jelly, lignocaine jelly, again to prevent localizing of a part, and this tube will enter smoothly inside to the nostril. Okay, so fresh gel we should use whenever we are introducing a nasogastric tube, and preferably we should use a sterile gloves. And after once you insert the Ryle's tube into the patient stomach, how to patient stomach, how to confirm by using of a syringe. Okay, 20 ml of or 10 ml of hair you can push inside the this Ryle's tube bend, so that with the help of stud we can hear the sound. Okay, if it is in a stomach definitely we'll get a sound. Okay, so we have to use a step to confirm the position of the Ryle's tube. And this is Ryle's tube fixing tape. Okay, so once after inserting of a Ryle's tube we have to fix it properly in a position. See here it is been given already the measurement. 14 gauge Ryle's tube can be used for the adult patient. So this Ryle's tube length is 1050 mm total length. So effective length is 1020 mm, and the diameter inside the tube, the diameter will be 5.30 mm. Okay, when you select a bigger gauge of this thing Ryle's tube, the diameter also will be larger size. Okay, when you select a smaller size of a Ryle's tube, see this is a pediatric Ryle's tube, gauge is 10. Okay, so this diameter inside the Ryle's tube diameter will be smaller size, 3.30. Okay, so this is the difference between bigger size and smaller size. So inside the diameter will be smallest, so inside it is very small, you can see. Okay, when you are selecting a bigger size the diameter will get increased, but length is same for all the Ryle's tube. Length is same, 1050 mm. Okay, so this is regarding a length and diameter of the Ryle's tube. Okay, so once insert the Ryle's tube, proper fixation you need to confirm. After fixation you have to fix the Ryle's tube with the Ryle's tube fixation. Okay. Okay, now we came to know what is Ryle's tube, what is the purpose of usage, and how to insert a Ryle's tube, what are all the material required during a insertion, and how to confirm the Ryle's tube. Okay, so now I am going to explain you what are all the contraindication for Ryle's tube. So when we should not insert the Ryle's tube for the patient, that is very important. The staff should know what are all the contraindication for Ryle's tube insertion. Okay, so when patient is having a esophageal strictures, okay, because of the risk of esophageal perforation, if you insert the Ryle's tube to the patient, no, when you are inserting definitely you will make a perforation of a esophagus. So when there is a esophageal stricture we should not insert a Ryle's tube. And esophageal varices, again there also when we are inserting tube, no, again there is a chances of getting bleeding, so this will make a trigger. Okay, triggering of a bleeding, so that we should not insert the Ryle's tube. And when there is a facial or skull fracture, definitely we should not insert a Ryle's tube. Okay, that is also one of the contraindication.